All right, everybody. So we'll get started here. What a great day. MoonCon has been awesome so far. So many great talks and speakers, and we really appreciate you joining us here in the Aroa Biosurgery booth. Again, my name is Dr. Brandon Bosquet. I'm a medical science liaison with Aroa Biosurgery, part of our medical affairs team. And today's talk, I want to talk to you specifically about using the Endoform extracellular matrix right in at home as part of a home health treatment protocol, specifically the antimicrobial version of Endoform. We have Endoform Natural and we have Endoform Antimicrobial, which some of our Endoform users currently may not be aware of. So let's dive into that a little bit. Now, first and foremost, I have to say thank you and congratulations to everyone that works in home health. As a podiatric surgeon, I rely heavily on wonderful home health because, like I always tell people, I can perform an amazing surgery. The results came out great, swimmingly, uneventful. But if the patient doesn't have the support of a good home health agency, then sometimes all the hard work we did in surgery can be for naught. And it's so important that our home health team can collaborate with me. I love reaching out to my home health nurses and aides so we can work as a team, not just me or the physician dictating what you're doing, but that we can work as a team to regenerate tissue and to heal our patients. So let's dive into a wound that I'm sure is very familiar to you if you work in home health. Here's a skin tear. An older patient has a lot of comorbidities, atrial fibrillation, kidney failure, liver failure, venous disease, and they just kind of bonk their leg on the side of a table, and now they have this nasty, painful skin tear. Again, a lot of times you think, oh my gosh, this patient's going to get infected. They're going to have to go to the operating room for a debridement. They're going to be in so much pain. They're going to be admitted to the hospital. But there's so much that you can do at home as a home health provider to get this patient healed and prevent all that expensive and excruciating problems that we can associate from these types of wounds. So again, this patient, very common, right? I don't know how old this wound is. I'm not sure what's been done to it. You're just kind of given this really complex wound when maybe the patient isn't the best historian, and they look at you and say, well, what can you do? And there's a lot that you can do as a home health provider. So again, 1 week of applying Endoform, and you can see that that wound is already improving. You see some of those islands of eschar right there. And from the previous picture, you can see that that's not terribly surprising. Some of that soft tissue is going to kind of die off and scab over it, and that's okay. But you already see that white arrow there is residual Endoform. It's kind of doing its work on the adjacent side, but some of that residual Endoform is kind of lingering around. You can see the middle part of the wound after just 1 week is already healing beautifully. And we talked about that. This is a patient that's a bit older, has some health issues that maybe they're not going to heal as quickly as some younger and healthier patients. Now, week 2, you can see, again, even the peri wound is looking good. The wound edges are flattening out. They're not rolled. All that eschar and kind of necrotic tissue has gone away. The Endoform has allowed for a new extracellular matrix to be laid down. And again, that white arrow there, some people might say, whoa, that's some slough. That's got to go. But in fact, that is residual Endoform. Very quick and easy way to tell, is this residual Endoform or is this slough that needs to go with good aggressive debridement? Take a little gauze, take your Q-tip and gently rub along that yellowish tissue. If it comes off pretty easily, then it's likely slough, non-viable tissue that needs to go. But if it doesn't come off and it's pretty adhered to the wound bed, then that's Endoform still working. So don't remove it. You can certainly add more Endoform around it, but that extra kind of residual Endoform, leave it be, let it continue to work. Week 3, you can already see that, again, the wound is almost kind of bifurcating. It's turning into almost 2 separate wounds because the middle part has already epithelialized. Again, you don't see any more of that necrotic tissue. You can see in the skin that it's kind of reduced in edema and inflammation. What the Endoform is able to do is modulate and lower that inflammation. But again, sometimes, as you probably know, with these types of patients, they need some good compression and elevation as well. Week 5. Great picture here because you can already see that it's healing. The adjacent tissue is less red and angry. It's looking more normal. And you can see some of those extra pieces of endoform there. If it's kind of crispy and a little bit and not attached to the skin, you can get rid of it. But if you look on the bottom part here, that's residual endoform. Do our little test, rub it on there. If it comes off, then good. It probably should come off. If it stays on, do not disturb. Leave it be. Week 7, again, you can see that beautiful granulation tissue. The wound is healed to almost about 80% at week 7. Week 12, that all important marker, that standard, is hoping to heal these complex wounds by 12 weeks. And right here, you can see it's already epithelialized. So again, week 0, here's a patient that's upset, in pain, nervous that they're going to have to go to the doctor's office all the time. And it's tough for them to get there. It's expensive for them to get there. They don't want surgery. They don't want to go to the hospital. But right there at home, you can heal that patient in collaboration with other providers. You can heal that patient at home without the expensive and cumbersome needs to go to other facilities and see other providers. You have that power. So again, I don't have to tell you all the challenges that our home health providers have to deal with. The patient may listen to the doctor and nod their head and say, that sounds like a great plan, doc. They go home and you try to execute those orders, and they may not be as compliant now that they've left the doctor's office, right? So compliance can be tough. Cost so many times, all the different treatments and dressings that are available are super expensive. A lot of times our agencies are a little bit tough and don't want all those expensive treatments. And sometimes the patient resources, they may not have the resources for all these expensive advanced biologic treatment modalities, but Endoform is priced responsibly, that you're able to get these patients advanced ECMs to regenerate tissue on day 1, right in the comfort of their own home. Again, these wounds can be very painful, but because Endoform is able to modulate a lot of that inflammation, it can help reduce the pain in the wound. And of course, first thing we want to do is to make sure that our patients are comfortable at home. We want to heal them. We want them to get better with their activities of daily living, but we want to reduce that discomfort first and foremost. And like we talked about, sometimes you don't have access to those skin subs and cellular tissue products and skin grafts that you would have to go to the operating room or the wound care center or inpatient hospitals to get access to. You have the power of a cellular tissue product or skin sub classified as an A code that you can put on right at home and get those patients healed. So again, no shocker here. We know how tough of a year it's been for everybody, especially folks that are homebound. A lot of times they couldn't get the care and access to good care that they did maybe in 2019. Thankfully, things are certainly turning the corner, but as we know, all over the world, and we have participants all over the world, we're all in different stages of kind of re-entering back into normalcy, whatever normal is, right? But remember, now with the Aroa ECM, with Endoform, antimicrobial, and natural, you have the power to regenerate and heal patients at home, regardless of if there's any flares of COVID. Even when COVID goes away and these patients still are unable to leave their home, you can get them healing by your own hands right at home through the Endoform ECM product. So let's talk a little bit about what really is endoform. So endoform is considered a xenograft, meaning it's harvested from another species. In this particular case, it's harvested from ovine or sheep forestomach. Now, the sheep come from the beautiful island nation of New Zealand, where there's actually a lot of sheep. Believe it or not, there's about 30 sheep to one person in New Zealand. This is a highly regulated and a highly powerful industry where all of the lamb chops and food and meat that we get from sheep go all over the world, and they a lot of times can come from New Zealand. So once those beautiful sheep are taken care of and respectfully raised and respectfully euthanized for food products, we can take those large forestomachs to create a wonderful extracellular matrix to heal patients. Now, if you look at this slide right here, this is what the forestomach of sheep looks like under a microscope. This bright pink on the top here is the skin cells, the epithelial cells. These oval pinks on the bottom is skeletal muscle. As you probably know, by having sheep DNA, foreign DNA, the body of your patient is probably not going to like that. It might get inflamed. So Aroa Biosurgery has this wonderful, gentle, proprietary way to get rid of all that sheep DNA, get rid of all those sheep cells, and keep intact that perfect, beautiful extracellular matrix, rich in all the different proteins and molecules necessary to heal it. Now, a lot of that is collagen. 85% of our soft tissue and extracellular matrix is made up of collagen, but that's not all. It's not just type 1 collagen. There's type 3 collagen, type 4 collagen, glycosaminoglycans like hyaluronic acid, fibronectin, elastin. There are so many proteins that make up the structure of our soft tissue, allows for cells to adhere to that structure and scaffold, and it allows the cells to communicate with each other and move in and out, whether it's regular maintenance of your soft tissue or if you're trying to heal the soft tissue. Now, Endoform a lot of times is up against other A-code dressings, collagen dressings that are considered reconstituted collagen matrices. Now, this picture here is a very powerful one. This is a micro CT, and you can see the Endoform is tightly bound, very conformed, collagen fibers, and you can see all the beautiful pores. The structure of your extracellular matrix is maintained. Whereas unfortunately with the reconstituted collagen matrices, it's kind of melted down, and then you take that type 1 collagen and they try to patch it together and reconstitute it. That little wire in the middle there is actually cellulose. They actually use that to give it some structure and kind of cobble this back together. So you see those paper clips there, and it's kind of a silly analogy, but it makes a lot of sense if you think about it. The two paper clips are kind of made of the same thing if you look at it, right? But if the collagen or the paper clip is not configured in the right way, then it's not really a paper clip. It can't do the job of a paper clip. So Endoform conserves the formation and the structure of the native extracellular matrix of people, whereas maybe the reconstituted collagen doesn't. So it gives you the ingredients, but it doesn't give you the structure. So another silly analogy I like to think of is a chocolate bar. I love chocolate. If the chocolate bar melts in your car or in your pocket and you take it out, no matter how hard you try it, you can freeze it, it'll never have that same shape again because you've melted it down. And if you've ever had a melted chocolate bar, yeah, it's still chocolate, but it doesn't have that same flavor. It doesn't have that same taste. So a silly analogy, but it's the same thing. You want to make sure that this extracellular matrix mimics the human soft tissue that we're trying to regenerate. So again, this is a nice graph here, a nice table here that shows you. So Endoform is considered an A-code surgical dressing, but on paper only, so that we can make it accessible to folks like you in home health. You can see that it has a lot more than just that type 1 collagen like we talked about. So in fact, it's actually biologically much more similar to those expensive cellular tissue products and skin subs that you see on the bottom, your Oasis, your EpiFix, your PureApply. As a podiatric surgeon, I've used those, and those work pretty darn well. The problem is that they're expensive, and I have to wait 4 weeks minimum to be able to put this on for a patient. So a patient is sitting there not getting better for 4 weeks before I can reach for one of these products. Endoform has the biology and the structure, sometimes even better than some of these cellular tissue products, these skin subs, but it's priced responsibly as an A-code dressing so that you can heal these patients on day 1. So let's dive in a little bit more about one of our specific products, antimicrobial. You probably see a lot of antimicrobial products out there. There's a great dressing, a foam dressing called Hydrofera. Hydrofera is methylene blue and gentian violet, so it's a great way to kill microbes as well. You probably see a lot of AG or silver products, but remember, all AG products are not created equal. So it's really important that you're able to differentiate between different products that have silver. Now, Endoform, our engineers were really, really clever. They had ionic silver, and that's different than your kind of garden variety silver that you might see in some other products. Another thing that's wonderful is that our engineers were able to make the silver slow release. We'll talk about that in a second. So silver, believe it or not, is one of the oldest antimicrobials known to man. Ancient civilizations use it. They didn't really know what germs were. They didn't really know what infection was, but they knew that if they used silver on these really nasty wounds, that their family members and loved ones they didn't die. So they knew that there was something special about silver, and we didn't find out till thousands of years later why, and we're still using silver, but we have to use it responsibly because unfortunately, silver doesn't know if it's killing a bacteria or a yeast cell or killing a good keratinocyte or epithelial or fibroblast cell. So we'll talk about how our engineers down in New Zealand were able to maximize silver without harming good cells. And Diana, I saw a great question from you. We'll answer some of those questions towards the tail end. So feel free to fill the chat box with some good questions and we'll chat about them towards the end there. So here's a great benchtop study that we were able to show Endoform's ability to kill bacteria and prevent any type of harm to the kind of the good cells, right? So if you look over here, this top square right here shows fibroblasts with no silver. So we know if there's no silver, the fibroblasts won't be harmed, so they'll be fine. That's our control group. The next one down here is fibroblasts with Endoform Antimicrobial. So if you say, well, geez, silver harms good cells, this one right here shows that actually, because of the way Endoform packages the silver and the type of silver that we're using, it's not harming the fibroblasts. If you look at this bottom panel here, this is fibroblasts, which are, again, the builder cells of our extracellular matrix, the regenerating cells, with your kind of reconstituted AG collagen product. I don't see any fibroblasts. That's those kind of blue spindly looking cells there. Unfortunately, because the silver was just dumped in all at once and it wasn't ionic silver, it killed the bacteria and the microorganisms there, but it also harmed the good fibroblasts. So while it's reducing that microorganism burden, unfortunately, it's killing the cells that are going to heal people. So it's not really doing fully the job that we want to do. But Endoform is reducing that microorganism burden while allowing for fibroblasts to live and proliferate. Super important. Now, like we've talked about before, unfortunately, a lot of the other collagen products that have silver or AG in it, they dump all that silver in all at once, and that's not very good. We want slow release silver, so it doesn't overwhelm and start harming good cells, and B, so it's able to control microorganisms for a long time. This table here shows you on the y-axis or up and down is how much silver is remaining, and the x-axis is time or days. So you can see right when you put it in there is 100% silver, and slowly after 7 days, you still have 60% of your silver there. So that helps to control your microorganisms while salvaging and protecting all of the good cells that are regenerating your soft tissue. So this is a table here that shows you some of the microorganisms that Endoform AM could help to control. Again, this is not an exhaustive list. These are the heavy hitters. And what jumps out to me, especially as a podiatric surgeon dealing with some really tough diabetic foot wounds and venous leg ulcers, is MRSA, right? MRSA and VRE, resistant, really tough to control bacteria, and Endoform AM can control them and reduce their existence in these wounds. Pseudomonas, another big one, and even some yeasts and molds like Candida. So be very mindful that these are all the heavy hitters, but it is all the different gram negatives and the gram positive yeasts and molds. Endoform AM is able to control those bacterium in the cell there. So let's talk a little bit about biofilm. Now, biofilm could be very, very difficult for wounds to heal. And the thing is with biofilm is it's not always easy to actually see it. When you have an active infection, it's smelly and red and draining and painful. But biofilm are kind of quiet bacteria. And Kathy Milne's lecture before, they referred to it as a force field of bacteria preventing new cells from taking that spot. So you want to be able to remove that biofilm, whether it's by antibiotic or what I like to do, sharp debridement, and then you can apply Endoform AM to prevent that biofilm from forming. So again, a nice little table here, which was done in a kind of a petri dish, if you will. The y-axis is how much biofilm, or how many of these kind of quiet bacteria just kind of milling around, not letting the wound heal. And then these are a couple of different options. So OFMAG is kind of the fancy way of saying Endoform AM. The collagen ORC are your reconstituted collagens, your prismas, your puricols, your fibricols of the world. Collagen and silver is the non-reconstituted version, and then gauze is kind of your control group. So you can see without any type of antimicrobial, almost right away, there is a lot of biofilm that is forming. You can see here, the initial biofilm is that line right there. And with the two collagen products, it's just a little bit above the initial biofilm. So it reduces it more than the gauze, but it's still more than the initial biofilm. You can see that the Endoform AM or the OFMAG is actually about a third of the buildup of biofilm after about a week. Really, really remarkable stuff to reduce that biofilm and that bacterial burden. Now let's dive into another one that you've probably seen. Unfortunately, this is a surgical dehiscence. This patient had a wide excision from a malignant melanoma. A patient that has cancer, they're diabetic. It's a large surgical dehiscence. You can see those rolled wound edges. It's a very large gash. And it's going to be really difficult to treat. This patient had been on Bactrim, an antibiotic, but that contaminated wound is still there. So what they did was they applied Endoform and Hydrophera Blue. So again, it says Endoform Natural there, but it actually is Endoform AM for this particular wound. And you can see that even right away, the peri wound is looking healthier. It actually reduced a little bit in size. And then you could see by week 4, wow, look at that movement there from the surgical dehiscence on a patient with diabetes and skin cancer. Again, Endoform AM was applied with Hydrophera Blue as your secondary dressing, your foam dressing. And you can see that it's already reduced by almost 80% after 4 weeks. By week 8, it's already epithelialized. And most importantly, remember that Endoform AM or natural, it's wonderful to get it from the inflammatory phase to the proliferative phase, but it also helps for the remodeling phase to minimize that painful, thick scar, which a lot of these patients, especially some older folks, might have to deal with. And it's not just cosmetic. Those scars can be painful. It can limit motion and movement if it's by a joint. So it's really important to allow for that forgotten fourth phase of wound healing, the proliferative and then into the remodeling phase right there. So again, week 0, it's big, it's contaminated, it's angry. They reduced the infection with Bactrim, but the wound was just simply not healing. And now you got it to the point where it's actually healing. So yeah, so that was 2 really kind of tough cases here. We really invite you. I know it's been a long day, but if you can stop by the booth, we are offering a WoundCon promotion where we can get some samples so that you can try Endoform AM for your patients in home health so you can get them healed, reduce that terribly hard biofilm burden, and get them to epithelialize and heal there. So feel free to reach out to us on LinkedIn or myself. I'm on LinkedIn, Dr. Brandon Bosquet. Please find me right there. And then, of course, you can go to Aroa Bio or reach out to live people on our customer support line by calling or emailing us. So I know we have some great questions. Let's dive into a few of them here. Yeah, so Diana, really, really good question. So me personally, I have not seen where Endoform will exclude a patient from approval from a cellular tissue product because technically in the eyes of the insurance, it's an A code dressing. So it should not hinder that. So it might be a paperwork issue or somebody that on the insurance side that may not know exactly the rules, but because Endoform is considered an A code surgical dressing, it should not preclude you from the approval of a cellular tissue product or skin sub in the future if you need that. So I'm not exactly sure what's been going on from that standpoint. So again, it's reimbursed as an A code dressing. So you're able to have our DMEs. If you have your Cardinals, your McKessons, your Byrams of the world, they all carry that product so that you're able to order it from there, and then they will be reimbursed by the insurance company. Obviously, if it's Medicare will cover 80%, and then there's a 20% copay that the patient will have to help out with. But no, from my experience, it should not preclude you. So if you had a specific instance, Diana, we'd love to chat with you to kind of figure out what's going on there, because again, because it's an A-code dressing, you should have no problems accessing CTPs or skin subs once you hit that kind of 4-week mark or beyond, if you'd like to go that way. We have a great question from Corinne as well. How can you explain the application and how often a new layer is applied, and if you need a contact layer over it, and do you leave the old remnant? So Corinne, again, really, really great questions. The application is very, very easy. So you simply put the extracellular matrix right on the wound bed. You can hydrate it with your normal saline solution or any type of exudate or blood from the wound. You'll start to see it adhere. You can trim it to size or fold it over top. Some people will elect to put some steri strips. For my contact layers, I really like to use something like a non-adherent, your Adaptix, your Mepitels, your Wound Veils of the world. I'm not a big fan of Zeroform because that petroleum can make things a little bit mucky and can kind of withhold some of that exudate. And then whatever your foam dressings are, we love Hydrofera. It really does well, but whatever your foam dressing du jour is, would certainly work well with Endoform AM. I'd be a little bit hesitant to use some of these foam dressings with silver in it, because then you might overload that silver and you might not see the magic of the Endoform Ionic Silver. So again, I've used Mapilex AG, for example, in the past, and that's a great dressing, but I wouldn't use them in conjunction AG products with the Endoform AM, because they're going to dump in that silver. You're not going to get that nice ionic silver slow release that we're looking for. And then again, Corinne, two great questions. A lot of times we like for you guys, our home health aides, to take a peek at the wound at about 72 hours, if you can. If it's all been kind of gobbled up and integrated, that means that the wound is very inflamed and you need more Endoform. So put it right in there. If you see any of those residual pieces in there, leave them be. You can test them by taking a Q-tip or a gauze. If it comes off easily, then it's slough. If it doesn't, then it's the good stuff, not slough. So leave it be, let the Endoform continue to work. You don't want to get it, remove it. There might be some cells starting to attach there. You don't want to get rid of all those growth factors and proteins there. So again, Vash is great. I love Vash. Hypochlorous acid is fantastic. What I would do is use the Vash to cleanse the wound before you put Endoform AM on there. But I would hydrate the wound with normal saline solution or with blood. Things like hypochlorous acid and some of the antimicrobial solutions can actually denature the extracellular matrix. So not an ideal thing to hydrate it with, but I love to wash the wound with that beforehand and then put your Endoform AM hydrated with blood, exudate, or normal saline solution. Got a great question from Jane here as well. How do I use Endoform AM and Endoform Natural? When should you switch? Great, great question. For the most part, if you've seen a wound for the first time, likely it's probably pretty contaminated, pretty inflamed, that you probably want to start with the Endoform AM. And then as the wound looks healthier and cleaner, and you see some of that residual Endoform AM in there, then now we're kind of less contaminated, less biofilm. So let's move over to the Endoform Natural. In my clinical practice, usually about 2 weeks of AM, and then I can transfer to natural to drive home that closure there. Diana, another really, really great question. So you could, again, you kind of want to dab it on there so you can utilize it on there, but I wouldn't want to actually hydrate fresh product on there because again, it can denature it. So if you use a little bit of Vash, maybe in the areas where there's some residual Endoform, you don't go crazy with the Vash, but in all the other parts of the wound that the Endoform has already been integrated and kind of gobbled up, go crazy with the Vash. Again, I love hypochlorous acid. If that's part of your wound regimen, kudos, it's great. It mimics the body's pH, which is wonderful. So you can lightly clean it with the Vash, but I wouldn't hydrate it with the Vash. Another great question from you, Diana. All right, we're kind of rounding in on the half hour here. Any other questions? Corinne, thank you so much. Yeah, wonderful. And again, we really, really invite you guys to stop by our booth, get some samples so that you can try Endoform yourself and let us know what you think. But again, wonderful. We really appreciate you. Again, my name is Dr. Brandon Bosque, Medical Science Liaison, part of the Medical Affairs team at Aroa Biosurgery. And thank you, and let's unlock regenerative healing for everybody.